Hello, everyone, and welcome to today's session on tubal block and infertility, brought to you by Apollo Fertility. To speak on this topic, I would want to welcome Dr. Pratibha Pasari. She's a senior infertility specialist, a laparoscopic surgeon associated with IVF Guwahati. To give a brief background about our doctor today, she's done her MBBS and MD in obs and gynae. She has done her fellowship in reproductive medicine and trained in advanced laparoscopic surgery. So she's a very well-known doctor associated with us who is going to speak to us and tell us what are the different factors of tubal blocks and how it can cause infertility and what are the treatment there. So, ma'am, we would be looking forward to hear from you on this. Yes. Thank you. As there would be any questions, I will be putting in the private chat to you. So we can take it after your call is done. Yeah.
Thank you so much,
Thank you.
Aarti. Thank you for the brief introduction. A very good morning to you all. Friends, today I'm going to speak on the topic tubal factors in infertility. Now, why have I chosen this topic? I have chosen this topic because many patients who are detected with tubal block in my clinic, they want to know, okay, ma'am, my tubes are blocked. Can I conceive naturally or not? So it is to clear their doubts, their confusions regarding whether they can conceive naturally or not if they have their tubes blocked. So to know about the tubes, we should first know what is a fallopian tube. So to know what is a fallopian tube, we should know that in a female body, there is one uterus, and on the side of the uterus, there are two fallopian tubes and two ovaries. In the ovaries, there are eggs. So for a natural pregnancy to occur, from the ovaries, one of the eggs get developed in the menstrual cycle and it's get ovulated in the mid-menstrual cycle. When it is ovulated, the eggs get released out of the ovary. It is then picked up by the fallopian tube, by this femoral end of the fallopian tube, which is open here. And the egg will enter inside this tube and it will come here. At the same time, if there is intercourse, the semen will deposit here in the vagina. From here, from the semen, sperms will travel through the uterus into this fallopian tube. The sperm will then meet the egg here in this fallopian tube. So this fallopian tube is the first site where the embryo is formed. Now when this embryo is formed, it will travel in 3 to 4 days from the fallopian tube. It will travel inside this fallopian tube in 3 to 4 days, and in 5 or 6 days it will go and attach to the lining of the uterus and pregnancy will occur. Now how does it travel? How does the embryo travel from here to the uterus? Inside in the inside of the fallopian tube, there are few tiny hair-like projections. We call them cilia. Now these cilia, they push the embryo towards the uterine cavity. So the function of the fallopian tube is number one. This is the first site of formation of the embryo. And number two, it pushes the embryo by a swaying movement of the cilia towards the uterine cavity so that the embryo gets lodged here in the uterine cavity. Now, what will happen if the embryo is lodged here? It is not swayed into the uterine cavity. When the embryo is formed here, if it is stayed here only, then it will cause ectopic pregnancy, which we say tubal pregnancy. Now, the tube is very thin, so it cannot distend more. It cannot hold pregnancy up to 9 months as a uterus does. So what will happen? It can hold pregnancy maximum up to 5 or 6 weeks, after which this tube will burst and will cause ruptured ectopic pregnancy. So it is very necessary that this embryo, when it is formed, it should go to the uterus and gets implanted there to cause a normal pregnancy. So this is the function of the tube. Now what if the tube is blocked? So if the tube is blocked, the tube may get blocked in the entire length. From here, which is the cornual end, to here, which is the femoral end, it may get blocked in any of the place. But the most common place is this, from the mid-third to the distal end. So this is the most common place of tubal block. So if there is tubal block, what will happen? The egg will enter here, egg will come here, the sperm will come here. But if there is a block here, then the egg will not meet the sperm and will not cause the embryo, and so the pregnancy will not occur. So if there is tubal block, the egg will not meet the sperm to form the embryo, and there will be no pregnancy. Now, tubal block or tubal factor is responsible for around 30% of all cases of infertility, and it is one of the most important factor for female infertility. So why does this occur? Why does this tubal block occurs? This tubal block may occur due to many reasons. The most important being infections, pelvic infections, which may go undiagnosed also. So if there are infections, the patient may have infection in the past, which may present today now as tubal block. The most common infections being chlamydia or the tuberculosis. Or she may have any previous surgeries in the past, abdominal surgeries, which will cause adhesion. If there are adhesions, the tube, it will get blocked in the sense that the tube will get engulfed in this adhesion, and there will be kinking of the tube, which will cause the blockade of the tube. Same with endometriosis. If the patient has endometriosis, so there will be adhesions inside the abdomen, and due to these adhesions, she may have her tubes blocked. And the tubes may be blocked as such for no other reasons. So these are the causes for which the tube may be blocked. Now, how do you know that your tubes are blocked? So when it does not present with any symptoms, like the patient will not complain of anything if she has a tubes blocked. It is very silent. We detect this only when we are when the patient is getting evaluated for infertility. It is usually diagnosed then, but the patient may have infections, and when she had done a sonography, then she may know that she have her tubes blocked. If she has any fluid or blood in the tube, which we call as hematosalpinx or hydrosalpinx. So if the tube block is due to endometriosis, then she may complain of painful menstruation. And if it is due to any infections in the vagina or genitalia, then she may complain of any kind of vaginal discharge or a vague lower abdominal pain. And if it is, she may know that if it is due to previous surgeries or due to previous ectopic pregnancies. So when a patient presents to us, she will not have any complaint of this tubal block. And when we examine her clinically, then tubal block is not diagnosed clinically on examination of the patient. When we take her for sonography, in sonography, we may detect tubal block only if she has her hydrosalpinx or hematosalpinx. Like if she has fluid in the tube or in the or blood in the tube, then only we can know that the tubes are blocked due to this reason in the sonography. Otherwise, we have to go for HSG, which is the tube test. HSG means hysterosalpingography. It is done in day 7 to day 11 of menstrual cycle. Here what we do is we inject dye inside the uterine cavity, and this dye travels from the uterine cavity to the tubes into the abdominal cavity. So when we inject the dye, we take serial X-ray pictures to see whether the tubes are blocked or not. Now HSG can detect many things, like first of all, it will say whether the tubes are open or they're blocked, number one. Number two, HSG will tell us whether at which place the tubes are blocked, the exact location where till where the tubes are blocked. And number three, it will also say whether one tube is blocked or both the tubes are blocked. So when we do HSG test, we come to know whether the tubes are open or they are blocked. But the most specific test to know the tubal block is laparoscopy. When we do a laparoscopy, we do a dye test which will confirm whether the tubes are blocked or not. But this is not done. Laparoscopy is not done just to check whether the tubes are blocked or not. If we are doing laparoscopy for some other reasons, then we may check there that the tubes are blocked or not. Otherwise, HSG is a good test to detect whether the tubes are blocked or not. So when a patient knows whether the tubes are blocked or not, then she wants to know whether they can conceive naturally or not. So here there are certain points which a patient should know. Firstly, her one tube is blocked or both the tubes are blocked. The treatment is different for both of these. Patient also asked me, "Ki, ma'am, whether there is any medicine which will cure this tubal block, or we can go for any operation which will open the tubes." So here I would like to explain that there is no medicine which will open the tubes. If it is due to infection, we may give antibiotics. If the infection is taken care of, maybe the tube may open, but as such, there is no medicine which will open the tubes. Secondly, for this operation to open the tube, this operation is called recanalization operation. So we can, earlier people used to go for recanalization operations, but nowadays we don't go for recanalization operation. The reason being, ki, what will happen if in a recanalization operation, suppose we open the tube gets opened, recanalizes, but the area where the tube was blocked, the cilia present there, they will get damaged. So the function of the cilia is lost there. As I had explained earlier, what is the function of the cilia? The cilia, it moves embryo towards the uterine cavity. So if the function of the cilia is damaged, the embryo will stay there in the tube and it will give rise to ectopic pregnancy, which again is a life-threatening condition. So in today's era, when we have such advanced techniques like IVF-ICSI, why to go for recanalization operation where we have more added complications? So now, if let's go for the management. If one tube is blocked and both tubes are blocked, like when a patient has one-sided tube block, then she may have a chance of conceiving naturally with one side of the tube and the ovary, but the chances is reduced by 50%. It's not that she will not conceive naturally if one-sided tube is blocked. She will conceive, she may conceive naturally, but the chances will be reduced by 50%. And again, if both the tubes are blocked, as I said, it's better not to go for recanalization operation, but to opt for IVF, which is a better option in today's era because it has come with no side effects, and patient does not have any pain in this, which patient used to have previously when the IVF was discovered. So this is a very pain-free process which patient can opt rather than going for recanalization operation. So this was regarding tubal block and fallopian tubes. I'm open for any questions if any audience has. Over to you, Aarti.
Ma'am, yeah, there is one question, ma'am, where a patient is asking, does a vaginal discharge leads to infection and cause tubal block?
Pardon?
The question says, does a vaginal discharge leads to infection and cause tubal block?
Not always. It will depend what kind of infection it is, and the infection has to reach the tubes. It is a long-standing infection, and especially of chlamydia, organisms due to chlamydia or tuberculosis, genital tuberculosis, then it may cause blockage in the tube. Not all vaginal discharges causes tubal block.
Ma'am, another question which is, what is the success rate with IVF if the patient is having a blocked fallopian tube?
See, blocked fallopian tube and the success of IVF is not like that. Ki, success of IVF will depend whether the tubes are open or blocked. If the tubes are blocked, we are going for IVF, right? It's not that the tube block will have any impact on the success of the IVF. In the IVF, what we are going to do is we are bypassing the tube. When the tube is blocked, if we can see here in this diagram, if the tube is blocked, we are taking the eggs from the ovary, we are taking the eggs out of the ovaries from the patient's body, we are taking the sperm, we are making the embryo outside the tube. This is the tube. Then normally with the embryo which is formed here, in IVF, what we are doing is we are making this embryo in the embryo laboratories, and we are transferring the embryo into the uterus. So we are bypassing this fallopian tube. So the IVF success is same as that due to other, if we are doing IVF due to other reasons. Suppose we are doing IVF due to other reasons other than the tubal block, it's not that success will differ in case of tubal block. It will be same. The IVF success will be same for any reason we are doing the IVF.
All right. Ma'am, that's all. No more questions. If you could, conclude with a concluding message, that would be great.
Yeah. So, in my point is like if the patient is trying, say, what is infertility? Infertility is the if the patient has tried for 1 year without any any protection and has not conceived, then they should go and visit IVF center, any center nearby their house, so that they get evaluated. Firstly, because as I have told, ki tubal factor is one of the most common reason for female infertility. So if the tubes are blocked and they are trying naturally, so they will not be able to conceive if the tubes are blocked. So if they are diagnosed early, then they may go for other options. When if one tube is blocked, they may try with either conception, spontaneous conception, or maybe they can move one step ahead with IUI, or maybe they can opt for IVF. And if both the tubes are blocked, they can opt for IVF rather than wasting time. So, time is very precious. One should not waste time. If they are not being able to conceive, they should go get evaluated in a IVF center so that the main cause of infertility is known and they get treated accordingly. Thank you so much.
Thank you, ma'am. Thank you so much for the wonderful session. I'll end the broadcast here. Thank you.
Thank you so much, Aarti.